Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, it's Lindsay Smith Rogers. Today, a conversation with two of the hosts of the Why Should I Trust You podcast. Brinda Adhikari and Tom Johnson join us to talk about their show, which brings together public health practitioners and members of the Make America Healthy Again movement to talk about public health issues. We also talk about a partnership that's evolved from these conversations, pairing public health researchers with community members in the response to the devastating train derailment that occurred in East Palestine, Ohio. Let's listen. Brinda Adhikari and Tom Johnson, welcome to Public Health on Call. How are you?
Doing good.
Yeah, we're doing well.
Let's start with you, Tom. Would you tell us a little about you?
Yeah, I've worked in TV journalism news for 3 decades, 2 of them at ABC News, a bunch of years at Bloomberg News. And then I was the showrunner and executive producer of a program on Showtime and Paramount called The Circus, which is a political doc series.
And Brinda?
Yeah, so I actually worked with Tom at ABC News a long time ago, and I worked at CBS News after that. And so I think in network news for almost 20 years. And then I worked for Jon Stewart, the comedian, at Apple TV on a show called The Problem with Jon Stewart.
And so we've brought you both on the show today to talk about your most recent project. So Brinda, do you want to talk about what you're working on now?
Yeah, so Tom and I, along with Maggie Bartlett, who was at Hopkins, and then Dr. Mark Abdul-Malik, we launched a podcast a little over a year ago called Why Should I Trust You that really aims to look at what looks like a breakdown in trust for institutions, but more specifically, we're looking at public health, science, mainstream medicine. And all of this is happening as there was a rise of this Make America Healthy Again movement led by RFK Jr. And we kind of wanted to have a show that was tracking all of this and also aiming to moderate conversations between MAHA and public health.
And Tom, would you give us a sense of how these conversations have gone?
Yeah, we pull together, as Brinda says, folks who support the MAHA movement. We bring together doctors, public health experts, government leaders, and we pull them all together into a conversation. And we basically say, we're going to be civil. We're going to talk this out. We're going to get to know each other, and then we're going to explore some topics together. And so a big thrust of it is to build up a little bit of personal rapport with folks. How do you come to this conversation? What was your journey here? And we find that in doing that right out of the gate, you start to get a little bit of shared humanity. And from there, we make our way. It's not a panacea, but we do make our way into some of the thornier topics that are sort of reverberating around our ecosystems. And we try and let people sort of give an honest take on why they think what they think and why they believe what they believe, and ultimately why they trust what they trust.
And Brinda, can you give us a sense of some of the topics that you've covered in the last year or so?
For sure, we've covered vaccines. That has come up because it is a divisive issue. And, why not jump right into that? But we also have talked about nutrition. We've talked about the EPA. We've talked about environmental exposures. We've talked about systems and, healthcare costs and Medicaid cuts. And also we've talked about, I'd say, not necessarily specific issues like that, but even more abstract things, but really important things like trust and expertise. And what does scientific expertise mean? The phrase lived experience comes up a lot sometimes I think as a way to push back against a certain type of expertise, but then that also opens up a lot of dialogue with, well, can you have lived expertise driving a scientific pursuit? And so these are really important conversations that I think for us as a society to be having in this moment. So yeah, those are just some of the topics.
Do you see people coming into these conversations with some preconceived notions that they're then able to kind of break down a little bit?
Absolutely. I mean, I think all of us come in with preconceived notions. We have our priors, we have our ways that we sort ourselves politically, culturally, religiously, all kinds of, regionally. As far as whether I feel like we succeed in breaking it all down and then everybody kind of walks away holding hands. I mean, one big phrase that people often say to us is like, this isn't some kumbaya thing, right? And we just hear that so much that Tom and I kind of joke about, like, should we rename the show like a kumbaya show? But it's really not. We're very aware of the moment that we're in right now. And so we try not to have the goal be that everybody leave in agreement, but actually arrive with curiosity and openness. And how we leave is really up to everybody there. There are moments, Lindsay, where certain conversations, I think everybody left feeling maybe even more tense than when they came in. But they also left with feeling somewhat of a sense of, I don't want to say achievement, but somewhat of a sense of like, well, I actually talked to the person as opposed to sparring with them on X or just kind of, speaking to my own tribe about this. Like, to actually be face to face with someone, you just show up differently.
Yeah, and from the listener experience of this, I want to say I share some of that tension. Sometimes I leave your episodes feeling like, well, nothing was really resolved there, but I'm still grateful for the conversation. And maybe, Tom, just really quickly, you can talk a little bit, you've worked in news for a long time. How are these conversations sort of a microcosm of what's going on in the country right now?
We hear the microcosm every week. There's a lot of mistrust. There's a lot of people who feel hurt. There's a lot of people who feel left behind or abandoned. A lot of it comes out of the pandemic, we found. That is still a very, very real and ripe topic for a lot of people. But ultimately, there's a lot of mistrust in institutions. And, whether that traces back to the opioid epidemic, whether it traces back to people's issues, achieving insurance, in this country, whether it's income disparities, there's just a lot of upset out there. And a lot of that is channeled towards health institutions. And, the microcosm is we try and talk about it and we try and air out those issues and respect those issues and those viewpoints. But like we're seeing in America, it's little baby steps moving towards something more positive than where we are currently.
And that's what we're here to talk about today, because these conversations are starting to play out into bigger things in real life. And so I brought you here today, not just to talk about the podcast, but specifically about a story about East Palestine. So Brinda, would you walk us into this situation?
Absolutely. So, we had done, I want to say like 2, I think, Tom, conversations by then between MAHA and public health. And just for your listeners, the way it often goes is you'll have like anywhere between 3, 4, sometimes 5 MAHA supporters with just the same amount from public health or mainstream medicine. And so we'd had a couple of these. And after one of them, our friend Elizabeth Frost from MAHA, Ohio, reached out to us to say that she had started getting just like learning of stories on the ground in East Palestine of folks, following the train derailment there that sent plumes of fire and chemicals into the atmosphere. I think I read somewhere like they carried the chemicals across 16 states. She had said that folks were still really not feeling heard and seen, and some were still experiencing symptoms, and while others were just really mistrustful of the government response. And so when we heard that, first of all, we were like, whoa, she reached out to a podcast and she reached out to us. And then we contacted somebody that has been on the podcast with Elizabeth, Dean Megan Ranney from the Yale School of Public Health. And Megan was like, yeah, I know this woman, Nicole Diesel, who's a toxicologist. And long story short, Nicole from Yale flew out to meet Elizabeth from MAHA on a sweltering 100+ degree day in East Palestine, Ohio. And they went door to door talking with residents. And, some of them were a little bit like, okay, who are these guys? But mostly they were open to chatting about their story. And pretty soon, Nicole decided to apply for a grant with the NIH to study water in East Palestine. And Elizabeth from MAHA wrote a letter of support inside that grant. They won the grant. And now they're part of a research collaborative with the University of Kentucky, Pitt, and Yale, working on the ground in East Palestine.
And before we get into the specifics of what they're doing in that study, I think it's important, and listeners can go and listen to that episode of your show, but this really was a case where you had a real-world crisis situation, and the response on the ground, people within the community felt like they had been failed by public health. So, Tom, can you talk a little bit about that?
Yeah, there was a lot of testing done by the government, and people didn't feel like they were being communicated with clearly about that testing result. They didn't really believe the testing results. Some of the messaging they felt that was coming out of government and health agencies was, it's all okay. It's all safe. We've tested. It's good. And that didn't land well with some of the residents. They felt they were experiencing symptoms, debilitating symptoms, whether it was skin irritations, eye irritations, breathing issues, and more serious issues. So there was a real disconnect there with what institutional science and government was saying to them and what they were feeling in their own lived experiences. And at the same time, the media was coming in and taking stories and leaving. And they just felt, everyone's coming here and either telling us a story or extracting something from us, and we're the ones left holding the bag. So it's not a happy scene there. And that's sort of the environment that Elizabeth from MAHA and Nicole from Yale kind of bonded together are now swimming in as Nicole carries out this research on the water safety.
And they came together and found commonality because of the conversations that you all had been having. So, Brinda, can you talk a little bit about their initial meeting?
Yeah, I think that Megan Ranney, she showed up on the show with such curiosity and openness to having these conversations with MAHA, and with her experience being an ER physician as well as the dean of a public health school, has just seen so much stuff both in practice but also in terms of the work she's doing with students. But I'd say that because she and Elizabeth really connected, that made, I think, Nicole feel comfortable. And then also what's great about Nicole is she's done so much work on the ground in the Ohio River Valley because she studied fracking and just health impacts of environmental triggers for a long time. So what we've noticed a lot on the show, Lindsay, is that when people align on personal values and stories, it can make the tougher things just not like better, but somehow give it a little bit of a landing pad or some cushion to begin the conversation, right? And honestly, Nicole and Elizabeth became fast friends. They're just two cool, fun women. And it's not that they don't have things that they disagree on, but they really feel so passionately about where they agree that they were like, let's forge ahead.
Yeah, and there's a ton of opportunity there, I think, within public health. But let's first talk about the specifics of where this NIH study is today.
Yeah, so it's just gotten started. Literally a couple of weeks ago, Tom and I were in East Palestine to mark the launch of the study. There was a ribbon cutting ceremony. Basically, these three universities have gotten a $10 million grant from NIH. It's not evenly split up. In fact, the water section, I think, would still like some more funding to really study it. Basically, they have been given funding to look at the health impacts when it comes to the actual health of individuals. So basically looking at the health impacts of the actual explosion in terms of toxins in the air and really asking the residents to share their stories and come to them, get tested, track their progression, and also talk to them about the mental health impacts of the explosion and what it's done inside the community. And then, of course, looking at the water. But what I'll say, and so they're just getting started, and we'll continue to go in and check. But these are people who are inside the community. The lead researcher, Erin Haynes from the University of Kentucky, she's from Ohio. She was boots on the ground really early. But look, there's going to be trust building that's needed to be done there too. These aren't like I said, while the community in East Palestine is very grateful, while many people are very grateful for the research dollars and the research that's being done, I think a big question, I think Tom can speak to this as well, is what happens next? That's a big question that we heard ask there.
Yeah, for sure. Nicole from Yale is making a water model. So she is going to try and, almost like a time machine, figure out where the surface water and what's below the surface water, where that spread from the crash site, the spill site, throughout the community. And that'll give residents, a sense as to whether their home and their private well was in that pathway or not. So that may give someone a little bit of solace, or it may put somebody on alert. But that's where it ends. That's the information that this project and this piece of science can help people. They'll have to continue testing the water on their own. We've talked to folks on the ground there that say, and what if the worst case scenario is found by these other studies that are being done, that there is a health threat here that does prove to be true? Who's going to be here 3, 4, 5, 6, 7 years down the road if we start to have health impacts? Who's going to pay for our health coverage? Who's going to take care of us? So there's a lot of questions. Science can answer some of them, but it's, again, not a panacea. There's a lot of places that this has to go from just where we are now.
I would just add that what's exciting, and I imagine, for your listeners, particularly at a school like Hopkins and other places, it feels like such a great, opportunity for academic public health to connect with people on the ground, which I know that work happens. I know that many people at places like Hopkins and Yale, they do that kind of work. But so often the image of public health and the image of medicine and science is of white lab coats, people sort of telling people what to do. And look, research, we all are so grateful for scientific research and innovation and all of that. But I think what is really exciting to myself and Tom about what we're seeing in East Palestine is that in so many ways, that connection, that bridge between science and the community is one that we're seeing in a really vivid way. And in a sense, I think I assumed that's what it was all the time. But from what I'm learning is that it often doesn't end up that way. So I think it could be a really interesting example. And look, like Tom said, we don't know if it'll end up being a successful partnership, whatever success looks like. But the effort feels noteworthy and the effort feels important.
Even just to the point that you both made about the lived experience and the mental health impacts. So often I think when we think of science, we think of positive or negative, A affects B, or this thing causes this thing. But the lived experience is what comes out on your podcast, like sort of the qualitative experience of all of this. And people are getting a chance to say, like, even if, for example, I don't have toxicity in my personal water supply, that thing really affected me. And I am feeling impacts years later. And I need a space to say that and have that recognized and have that counted as part of the fallout of this incident. Do you feel that that's accurate?
Yeah, for sure. It comes up a lot. I mean, a lot of times the folks that come on our podcast really just want to be heard and want scientists, want public health officials to hear that side of the story. This may not be something that's provable in a lab, but this is how I feel. And this is the way, whatever this development was, or whatever the trauma from the pandemic, or from the effects of a policy that I had to endure to get through that pandemic, this is how it made me feel. And I want you to recognize that. And, again, to the credit of the folks that come on our show from public health and mainstream science, or whatever terms we want to use to describe that voice, they are passionate about listening to that, to hearing those voices, and appreciative of the honesty that comes across in these episodes.
Yeah, and it works both ways. Like Brinda, the public health people on your podcast also get a chance to say, you know what, I'm passionate about my work, and I have not always been treated well either for that.
Absolutely. I mean, I think one of the things we've really seen on the show is that both gives an opportunity for the scientist, the expert class, to show up as their full human self. We've talked about an example where Dr. Craig Spencer from the Brown School of Public Health, we're just naming all the schools of public health on the show, but, where he was on a show with some MAHA supporters who were talking about the opioid epidemic in where they're from. And then Craig revealed that his family has also been impacted impacted by the opioid epidemic. And that connection both allowed Craig to speak as just like a son, a brother, but also as an emergency physician and a public health specialist who looks at it from the population health place. And yes, I think that there are people in public health who are like, man, it's hearing people assign a motive to me that I know in my heart I just don't have is really frustrating. To say that I'm being paid off by pharma when I'm working at a local health department and making like no money, it just doesn't make any sense to me. But I'm also hearing that something isn't working for you, and can we focus on that? So absolutely, it's really exciting, I think, to just see everybody in their full humanity, no matter what that, looks like sometimes.
Last question for you, and we'll start with Tom, and then Brinda, you can do last words. So you have this project going on. It's just kicked off. You're not sure where it's going to go. You see other things start to come up on the podcast. It's not just all thoughts and feelings. There are concrete issues here. Do you see the MAHA community and the scientific community maybe starting to align around some of these issues that are solvable problems?
Yeah, we do. We believe that's possible. We believe there are certain issues like vaccines, which it's a life and death issue, and there's a real disconnect on something like that. In some cases, again, MAHA is not a monolith, nor is all of public health. There's places where people can have more honest discussions if they don't just retreat behind their barricade. But yes, there's other issues, and a lot of it, I think, moves into the food space, moves into the toxic exposure space, moves into sort of faith and science space where there could be collaborations. There is room. There is shared interest. There is commonality. And that is what is really exciting to us. If people are willing to respect the profound differences they have on this thing, to find some common ground on these things, we might be able to move forward in a new way, but at least we're moving forward, for the betterment of people's health.
And so, Brinda, what's on the agenda? Where do you see this going forward?
Yeah, I think that there are a lot of opportunities. And at a time when I think a lot of political sands are shifting, we really don't know how things are going to end up. I know that there's some folks who are like, well, if we just get, quote unquote, our party back in the White House, then everything will sort of either go back to, quote unquote, normal. And I think, working with folks on the ground level, at the grassroots level, or just outside of the sort of two political party system, you realize that these issues don't just go away for people based on who's in the White House or who's in Congress. That all of us, need people to be thinking about this all the time because it's our lives, it's our families, it's our kids. And so I think the opportunity that's presenting itself right now is truly a frustration with the two-party system and feeling as though there's an opportunity to collaborate with people kind of outside of the parameters of just, I'm only going to do this if it's for a Democrat, or I'm only going to do this if it's a Republican. And quite frankly, there are some interesting fissures that we're noticing with MAHA right now for this administration, which again, to me it's just illustrative of a movement that is really driven not so much by who's in the White House, but who is actually caring about the issue that they care about, right? So all that to say, yes, I see tremendous opportunities.
Well, Brinda and Tom, thank you so much for all of the work that you're doing to host these conversations, facilitate these really difficult conversations, and for being on our show, making the time to come to us.
Thank you very much.
Thank you so much.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith Rogers, Stephanie Desmond, and Rachel Walsh. Audio production by Michael Bonfils, Matthew Martin, and Philip Porter, with support from J.B. Arbogast, Spencer Greer, and Chip Hickey. Distribution and social media by Rachel Walsh, with support from Nick Moran and Brianna Iacovelli. Follow us on Instagram and Blue Sky at Public Health Pod for more public health takes and special content. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.